So without further ado, I'll start with the slides now. And also, during the slides, there'll be moments, there'll be certain quizzes, quick quizzes, where I'll ask you a question and see if you can respond, and I'll give you the answer immediately. But while you're watching, if you can grab a piece of paper and a pen and write down any other question. Perhaps you'll see something from the presentation that'll get you to think about a situation that you encountered in your life or a question that you have about Medicare and you always wanted to ask. So write it down so once it's done, I can answer it or call you back and follow up with you. Okay. So this session should compare the parts of Medicare and coverage options, explain benefits and costs, discuss how Medigap policies and Medicare Advantage plans are vastly different, describe the federally facilitated health insurance to marketplace coverage. We're also going to talk about Medicaid and related resources for those people who are income eligible and qualify. So what is Medicare? It's health insurance for people who are 65 and older, and some people who are under 65 with certain disabilities. Amyotrophic lateral sclerosis, also called Lou Gehrig's disease without a waiting period. Note, to get Part A and B, you must be a U.S. citizen and lawfully present in the United States. What agencies are responsible for Medicare? Well, the Social Security enrolls most individuals, while the Railroad Retirement Board enrolls railroad retirees. And then you see the letters CMS, which stands for Center for Medicare and Medicaid Services. They handle publications and claims. Many times when you receive letters, you'll see those CMS logo on the notification. What parts consist of Medicare? Well, for original Medicare, and original Medicare is what everybody is rolled into when they first join the program. You have your Part A for hospital insurance. You have your Part B for medical. Your alternative to original Medicare is Medicare Advantage plans. Many of you probably heard of Medicare Advantage plan referred to as Part C. Well, it also includes your Part A, your hospital coverage, also includes Part B, which is your medical. It usually contains your prescription drug coverage as well, otherwise known as Part D. In your last box, over to your far right there on the screen, you'll see Medicare prescription drug coverage. Now, that's a standalone plan designed to work with original Medicare only. So regardless of which side someone chooses, you can have prescription plan on either side. Just remember, though, original Medicare is nationwide coverage. And if you might want to write that down, it's perfectly fine. That means no matter what state you're in, you got coverage. Medicare Advantage plan, these are vastly different. These are HMOs or PPO plans. And often when you get your services in an Advantage plan, you have to contend with networks, except for if it's a PPO, which is a preferred provider organization, would give you much more freedom when visiting your doctor or specialist. The good thing about Advantage plans, though, is that they clearly identify what you're going to pay at the hospital, the doctor's office, or the specialist. So you always know what you're going to pay. It's clearly marked on your card. Whereas original Medicare, you pay a certain percentage for the cost of services. So there's no set number, it's just a certain percentage, and depending if the procedure is very expensive, Medicare is going to cover 80%, and you're responsible for the leftover 20%. We'll go into more of that later. So again, there's two main choices, either original Medicare or Medicare Advantage plan. When you look over to the far left, you can see original Medicare, composing of your A, hospital coverage, and your B for medical. Then you see at the second tier, you got D for drugs, and then beneath that, you see Medigap supplement insurance. Well, anytime you see Medigap, realize that means supplement and Medigap. It means the same exact thing. It's just insurance that fills the gaps in Medicare so that you have an insurance that pays the leftover costs so that you're not worried about paying those costs. Does everyone follow me there? All right. And there we have the Advantage plan off to the left. Off to the right. Include your A and your B and your prescription drug coverage as well. These Advantage plans may include extra benefits that aren't offered under the original Medicare side. And these extra benefits are like dental, vision, and hearing. And sometimes they can even offer exercise benefits and over-the-counter drug discount cards too. Let's talk about automatic enrollment into Part A and B. It's automatic for those who are already receiving your Social Security benefits, and if they're receiving it, they don't have to worry about it, they are automatically enrolled. All railroad retirement benefits also. So their initial package is mailed 3 months before their 65th birthday or the 25th month of receiving disability benefits. If they're going to keep it except Part A and B, they're just going to simply use it at their local physician office. If they're going to return it somehow because they have insurance to their job and they're not ready to enroll in Medicare yet, they can do that so by just following the instructions and sending the card back. So this is when you must take action to enroll in Medicare, when it's not automatic. And this is when you're not automatically collecting Social Security benefits, then you wouldn't be enrolled in Part A and B automatically. You would have to contact the Social Security office directly to enroll. And the same for those people who are retiring from the Railroad Retirement Board. If they're not getting that automatically, they would still have to contact the Railroad Retirement Board to enroll. So when to enroll in Medicare? Well, there's a 7-month initial enrollment period that surrounds your 65th birthday or 25th month of receiving disability benefits. And this time includes the 3 months before your 65th birthday, the month of your birthday, and the 3 months after. A person can enroll in free premium Part A during any time this initial enrollment period begins. And they can only enroll in Part B and premium Part A during initial enrollment period and other limited times. May have a lifetime penalty if they don't enroll during the initial enrollment period. This is why this is so crucial. Then we have the general enrollment period. For those people who didn't sign up for Part B or Part A during initial enrollment period, they have a next opportunity to do so in January through March 31st annually, but the coverage is not starting until July. And they may have to pay a penalty, 10% for twice the number of years they could have had Part A but did not sign up, 10% for each full 12 months eligible but not enrolled in Part B as long as you have Part B. So these penalties can be long-lasting, and it's best to avoid them. Premium Part A and Part B special enrollment period. So most people don't qualify for a special enrollment period. You must have had employer group health plan coverage based on active or current employment of you or your spouse. And these people can enroll anytime you're still covered by the employer group health plan or within 8 months of losing that coverage, whichever happens first. And note, retiree and COBRA aren't considered active employment, and people should be cautioned about delaying Medicare enrollment if they only have retiree and COBRA. So here's our first quiz. So why is your Medicare initial enrollment period important? Is it because A, missed enrollment deadlines could result in penalties? Or is it B, it's your first opportunity to enroll in Medicare? Or is it C, when you enroll impacts when your coverage begins? Or is it D, all of the above? Anyone wants to go for that answer?
I'm always a fan of all of the above.
Excellent, D, all of the above. Excellent, thank you. All right, lesson 2. How do you want to get your Medicare coverage? Original Medicare or Medicare Advantage plans? Should you take Part A or Part B? If so, when? Do you need a Medigap policy, or otherwise known as supplement, to fill the gaps in original Medicare? What about Part D? Do you have prescriptions that need to be covered? What do I need to do if I'm not retiring at 65? These are all questions that are going to be on people's minds, and if they're not retiring, they definitely want to let Social Security know office know that they're continue working and they want to continually build their Social Security benefits. And they're going to let them know that whether they want Medicare Part A or B or not at that time. Original Medicare, continuing, Part A, hospital insurance. Hospital insurance helps covers medically necessary services, inpatient care in a hospital, semi-private room, general nursing, other hospital services and supplies, as well as care in an inpatient rehabilitation facility, and inpatient mental health care in a psychiatric hospital, and that benefit is limited to 190 days in a lifetime. Inpatient skilled nursing facility care, after a 3-day inpatient hospital stay, if you meet all the criteria. So basically, I like to use an example here. If someone was hurt and they went to the hospital under Original Medicare, and the hospital said, you know, so perhaps you stayed 2 days in the hospital, and they recommended you go to rehab. Well, you would be alarmed if no one told you that there was a 3-day required stay at the hospital before you go to the rehab in order to get the first 20 days free. I imagine most people would be alarmed by that, but by you being armed with that information and knowing that a 3-day prior stay is required before you go to a skilled nursing facility or rehab, that's useful information to you, especially if you meet all the criteria. Okay. So hospital insurance, continued. So hospital Part A also covers blood as an inpatient, certain inpatient non-religious, non-medical healthcare and approved religious non-medical institutions, home health care, if the doctor certifies that you need it, hospice care, and then we're going to take a look at things that are not covered: private duty nursing, private room unless medically necessary, television and phone in your room if there's a separate charge for that, usually there is, personal care items like razors, slipper, socks, those types of things. Okay, so paying for Medicare Part A. Most people don't pay a premium for Part A. If you paid federal insurance taxes for at least 10 years, it's equivalent to 40 quarters, then you've paid Part A. However, if you paid less than 10 years of federal taxes, you can pay a premium for Part A. And if you're one of those individuals who pay a premium for Part A, I will give you my contact information, and there's programs to help people pay for that for Part A and Part B if you're income eligible. But if people sign up for Part A late, they may have to pay a penalty if they don't enroll when they're first eligible, and their monthly premium can go up 10%, and you'll have to pay the higher premium for twice the number of years you could have had Part A but did not sign up. Now this breaks down to Original Medicare Part A. What is a person expected to pay while at the hospital? And so at the hospital from days 1 through 60, there's a $1,408 deductible to be met. That's the patient responsibility. Anytime they're in a hospital from days 1 through 60, if they stay 2 days, still they're going to be billed that deductible. And that can be difficult to be met. There are supplemental insurances that can actually pay that deductible for a beneficiary so that they don't have to worry about that. After 60 days, on the 61st day, there's a copay of $352 from 61 through 90, and then after 90 days, the copay jumps to $704 per day, and then lifetime reserve days in each benefit period. So we can see how if someone didn't have a supplement, and if they were experiencing a long stay in a hospital, how this could amount to a high cost. I also would like to say the billing for Advantage plans is going to be different. They normally do their billing for like 1 through 6 days or 1 through 7 days, and it'll be like $165 to $350. So with Advantage plans, you always know what you're going to pay. With Original Medicare, you always go by a certain percentage. But with Original Medicare, all these costs that you see here, they can be covered by a supplement. Now we're going down to the skilled nursing facility care, 0 for the first 20 days in each benefit period, provided a person had a 3-day stay at the hospital first. And then the skilled nursing facility is going to charge the person $176 for days 21 through 100 in each benefit period. and then they're responsible for all costs after day 100 in the benefit period. Home health care services, $0 for home health care services, and then they're responsible for the 20% of the Medicare approved amount for durable medical equipment. So benefit period is just simply a time where a person accesses the hospital or skilled nursing facility benefits. And it begins the first day they enter the hospital or skilled nursing facility, and it ends right when they have left that facility and 60 days in a row has passed by. That sort of closed the Medicare billing clock. They're responsible for paying the Part A deductible in each benefit period, that amount that you're seeing on the screen, which was the $1,408. And there's no limit to the number of benefits a person could have, or benefit periods, sorry. No limit to how many benefit periods they can have in a year. So, do you need to sign up for Part A? Well, consider it's free for most people. You can pay for it if your work history isn't sufficient. There may be a penalty if you delay. If you or your spouse is actively working and covered by an employer health plan, you're going to talk to your benefits administrator to find out its relationship with Medicare and stop contributions to health savings account 6 months prior to Medicare enrollment. There may be certain tax incentives for having a health savings account, and when you're enrolled in Medicare, that ends, so no one wants to continue doing that once they have Medicare. Part B, medical insurance, covers doctor services, outpatient medical and surgical services and supplies, clinical lab tests, durable medical equipment. You may need to use certain suppliers, diabetic testing supplies, preventative services like flu shots, yearly wellness visits, and home health care. Part B, what you pay. Standard premium was $135.50 or higher depending on your income. So that number is changed for 2020. If a single individual earning on the far left $85,000 or less, or a couple filing joint tax returns at $170,000 or less, or a person filing separately, they're going to be paying $144.60 a month, and that's each. So as their income increases, so will their contributions in paying for their Part B premium. And at the highest level, we'll see an individual above $500,000, or a married couple above $750,000. They're going to be paying $491.60 each for their Part B premium. And this doesn't include any late enrollment penalties if they enrolled while they were late. Part B, what you pay in original Medicare. Okay, so Medicare, original Medicare covers roughly 80% of healthcare costs, and with that speaking, we're talking about Part A and Part B. But before Part B covers its 80% of healthcare costs, the beneficiary is required to pay a yearly deductible, the $198 yearly deductible, one time a year. Then Medicare pays its 80%. Beneficiaries are billed the leftover 20% for most covered services like doctor services and some preventative services if the provider accepts assignment. Now, I'm not sure if you ever heard of the term assignment. It's a formal agreement between Medicare and a doctor stating that they're willing to render you services for the agreed upon amount that Medicare is willing to pay them. So it's important to go to a doctor who accepts assignment because, you know, there wouldn't be any left over to pay in terms of what the doctor has requested. It doesn't mean you can't go to a doctor who doesn't accept assignment. It just means that the doctor will bill you for the difference, or perhaps you'd be sent the bill and you'd have to submit it to Medicare. Either case. 0 for most preventative services, 20% co-insurance for outpatient mental health services, co-payments for hospital outpatient services. Okay, so should you keep or sign up for Part B? Well, consider most people pay a premium for it. It's usually deducted conveniently from their Social Security or rare retirement benefits. Amount does depend on income, and it may supplement your employee health coverage, sort of paying for the leftover costs if you have any from employee health coverage. Going to contact your benefits administrator to understand the impact to your employer health plan. Okay. Did I have a question? Someone have a question? No? Okay. So these are cases when you must have Part B, and I realize that this may not apply to anyone, but may. If you want to buy a Medigap policy, which is supplement, you must have your Part A and B. If you want to join a Medicare Advantage plan, you're eligible for TRICARE or Champ for Life, or your employer requires that you have it. Usually a smaller employer, less than 20 employees. You're going to talk to your employer union benefits administrator. Veteran Affairs VA benefits are separate from Medicare. You pay a penalty if you sign up late or if you don't sign up during the initial enrollment period. Part B and active employment. If you don't have coverage from active employment, delaying Part B may mean higher premiums, paying health care out of your pocket, waiting to next general enrollment period to enroll, which is January through March 31st, with coverage not starting until July. And if you do have coverage through active employment, you may want to delay Part B. It certainly saves people from paying the $144.60 per month. And there's no penalty while you enroll while having the coverage or with you losing employment, whatever happens first, as long as that's done within 8 months. So we're going to quickly check your knowledge. Medicare Part A helps pay for all of the following when medically necessary, and requirements are met except for, all right, so we're looking for something that Part A doesn't pay for. And I'm going to help you. Do we have any volunteers? Okay. I'll go. All right, so Part A covers inpatient hospital stays, so we're looking for something that Part A doesn't cover. We know that Part A covers inpatient skilled nursing, and Part A also covers hospice care. But Part A doesn't cover diabetic testing supplies because that's covered under Part B. Okay. For Medicare Part B, in most cases, you pay, is it A, a monthly premium, B, a yearly deductible, C, 20% coinsurance for most covered services, or all of the above?
Same answers before, all of the above.
I'd go with
I think you did the last one. Weren't you about to say it on the last one?
door number.
Yes, yes, yes. I wondered, how did you know that? Okay, all right.
Yes.
Okay, so now we're talking about Medigap policies, which are Medigap policies are just another name for a supplement. It fills the gaps in original Medicare. And in the previous slides, we've seen original Medicare expenses for the hospital and a doctor's office. And some of those expenses could be pretty significant. The Medigap policies fills in those gaps. Original Medicare covering roughly 80%, and then the 20% can be covered with Medigap policies. All plans with the same letter have the same exact coverage, and plans are different in other states like Minnesota, Wisconsin, Massachusetts, but we're primarily concerned with New York State. And here is a picture of what the Medigap policy is like. So this is like a flow chart here to quickly identify which plans, A through N, that offers the benefits that people need, the benefits that someone is looking for. So someone would look at this and say, okay, how do I find a plan? How do I choose a plan that's going to be right for me? So on the far left, you'd see in blue, dark blue, you're going to see all the benefits that these plans provide. Those benefits are actually the bills that the plan pays under original Medicare. So for instance, 1, 2, 3, 4, the fourth line down under the benefits section, it says Part A hospice, coinsurance or copayment, and then beneath that, the hospice care coinsurance. So that's covered under Part A, but there's a certain percentage that is left over for the beneficiary to pay. And so any plan that's marked 100% on that same line as we go across, whether we're talking about Plan A, B, or C, all those plans that's on that same line that says it covers that at 100%, there's no cost left to the beneficiary if they have that plan and if they're looking at that benefit. However, on that same line, if we go further over to Plan K or L, we can see K is only paying 50% of that Part A hospice care coinsurance or copayment, and Plan L is paying 75%. Surely K and L is going to be cheaper monthly and probably more affordable, but but is it going to be affordable when it really comes time to using that plan and it doesn't cover as much as somebody hoped to? And I can just cut to the chase for the sake of time, but Plan F, we noticed that plan has a lot of 100% down the column. And so that's the most coverage someone can attain for a Medicare supplement or Medigap plan. And sadly to say though, Plan F, I apologize, Plan F is no longer offered for people who are newly eligible for Medicare in 2020. So the closest that someone could come to a Plan F is a Plan G. And so what we do when we sit with people is review these options, considering how much they need in coverage and what their budget will allow to get them the best result.
So Ron, sorry to interrupt you there, but we were aware that Plan F was removed this year. Is it because it did provide such a wide range of benefits, or were there other reasons behind that?
Yeah, I have not received any input on why that was removed. I was sad to see it go, to be honest, because I know it met a lot of people's needs, and it was less in our arsenal to educate people and to help them. But I have not received any feedback. I did not inquire to New York State Department of Finance and Insurance, but I'm sure that's the website where this information and the latest rates for supplements is given. And whenever these companies wants to change something to one of the plans, or whether it's benefits or rates, they have to first go through the New York State Department of Finance and Insurance, and it has to be approved. So I didn't examine why these changes were happening. It's something I could probably investigate if somebody wants to know. But we were sad to see it go.
And then one more thing, I think Heidi has a question, but I just want to let you know we do have people on the call from Georgia and Vermont. So that, I just want to make sure, do these things also apply? You had mentioned Wisconsin and I think Michigan. They aren't the same. Georgia.
Well, all right. Well, I'm glad that you have other people from other areas. So the way it works, for instance, let's say if somebody was looking at supplements in Vermont, you would just call up your local office for the aging. They'll send you the supplemental plans offered in your region, in your area for Vermont, and that way you can get a list of those plans and examine those. But what we see here is the chart and how to pick them and make those selections. That's the same. The only thing that's going to different, the only thing that's going to be different is, the companies offering those and maybe the prices. But the benefits, Medigap policies are nationwide. So that means,
I wanted to make sure. And I think I had a question.
Yeah, I think they discontinued F because it was such a phenomenal plan, frankly. And I think it's cost prohibitive and not sustainable, because Medicare is costing states a lot of money. I noticed in the bottom it says Plan F is also offered as a high deductible plan by some insurance companies in some states.
Yeah.
Can you elaborate on that?
Well, see, I can't comment on what's offered in other states, but it is possible, like if you're from Vermont, you would have to go to the Vermont State Department of Finance and Insurance to find out, because each state, they're going to have their own different rates, but whether we're talking about a Plan F or Plan G, the benefits are going to be the same. I just know in New York State, F was done away with, whether we're talking about the high deductible plan or the regular one. Either one was, it just is not offered anymore.
Well, they both pay the excess charges, which to me is the biggie. But I did notice the Plan B deductible is not covered under G. And that B deductible was pretty high, was it not?
Well, I want to thank you for your question. Part B deductible, it's $198 now currently.
Okay.
it's when comparing that deductible to all the other costs you could actually have, and this deductible is one time annually. So
Okay,
initially,
it's not material.
it's not too bad. In your first doctor visit, you know, you pay your doctor bill, your doctor submits it to Medicare, it's taken care of. You met that deductible, you know, so it's a little something extra to deal with, but it could have been, you know, I'm glad that, you know, it could have been different, you know.
Yeah, $200 is not material when you're looking at pretty close to a catastrophic coverage.
Right.
I think the Part B excess charges that it will cover that. So if you go to a specialist and they disallow it, I think to me that's a material point that they'll pay 100% of the excess charges. That turns it into like a major medical.
Yep. I want to say one more thing. Here's another tip for you concerning excess charges. If you go to a doctor who accepts assignment, that's one way to avoid excess charges. And you have a right to ask that before your procedure. So
That's interesting. I didn't realize that.
Oh yeah, you make sure they pay their reasonable and necessary charges. They accept assignment. If they don't accept assignment, you get into that with specialists. Then the fun begins if you don't have 100% Part B excess charges.
Right. Because there was a supplement that pays the excess charges, but we often empowered people by telling them to ask first and go to doctors who accept assignments, so you won't fall into that situation to begin with.
That's a good suggestion.
All right, thank you, Ron, for being willing to answer our questions mid-presentation.
Yeah.
That's okay. That's awesome. I'm sorry I didn't know that much about other states. I apologize.
Oh, that's okay. We were just making sure that they were aware that these were standard for most states that we're discussing right now, and that just the cost might be different and the providers. But as long as
correct.
So we're good. Don't worry about it.
All right. Now, after this discussion, a person is deciding, do they need a Medigap policy? It only works with original Medicare. Do you have other supplemental coverage? Perhaps you might have a retiree plan that can pay secondary to Medicare. I mean, that could be beneficial. If so, you might not need a Medigap policy. Can you afford the deductibles, the co-payments, and what does the monthly Medigap premiums cost? So if you're in the Clinton County area, I would be happy to send those Medigap premium costs. I can mail that out, or I can send them by email. So, but if you're in another area, another state perhaps, I would ask you to visit your local office for the aging where you live, or visit the state's Department of Finance and Insurance for the state that you live in, and examine supplemental policies. Because that's the way it's arranged in New York State, and I imagine that it may be arranged the same way in another state. Okay. So when is the best time to purchase a Medigap policy? Your Medigap open enrollment period begins the first month you're 65 and you have Part B. This period lasts 6 months. It may be longer in your state. You have guaranteed protections, and company must sell you a plan if you're in your open enrollment period. Now, that doesn't mean you can't purchase a Medigap policy after that period. It just means there may be restrictions, like sometimes supplements or Medigaps, same thing. They may impose a pre-existing waiting period so that they're not necessarily responsible for something that you had prior before taking out the policy. So we've seen that happen too. In a situation such as that, if a person had a Medicare Advantage plan prior to enrolling into a supplement, then that pre-existing waiting period can be eliminated because they had credible coverage, comprehensive coverage before the carrying out of the supplement policy. And the same thing could be said for an employer health plan or any other comprehensive coverage. So there's ways to limit that restriction if that applies. Okay. All right, so to purchase a plan, you're going to follow the steps. You can go to Medicare.gov, and if anyone has a pen and paper nearby, could you write that down? This is going to be useful. Medicare.gov is the government websites where you can review, compare, and review upcoming plans, And also, I want to say the new Medicare plans are going to be released October 15th, which is really, really getting close now. October 15th through December 7th is your time to compare, review your Medicare health plans, and see if your coverage is what you need for the next upcoming year. If you already have Medicare, you want to check the notices that you're getting in the mail concerning plan changes for next year. Do not let those plan changes slip by you, because sometimes we speak to people and they don't know about the plan changes until January, and the plan is already set in place. You know, so we don't want people to encounter that. Okay, so Medigap insurance policies help pay for prescription drugs. Do you guys think that's true or false?
True.
There you go.
So, okay, so supplement or Medigap insurance only has one purpose. That's to supplement your Part A and your Part B. It does not cover drugs. Okay, now, Medicare Part D, prescription drug coverage, available to all people with Medicare and provided through Medicare Advantage plans, and also provided through Medicare prescription drug plans Part D, and some other health plans as well. And it's optional. You can choose a plan and join. You may have a penalty if you join later. And plans have formularies, which is a list of drugs that they cover from Tier 1, Tier 3 to Tier 5. You pay the plan premium, and you pay deductibles and co-payments dictated by the plan. There's extra help to help with drug premium costs and co-payments if you have limited income and resources. So if anybody has questions about that, please follow up with me. And who can join Part D? You must have Part A and or Part B to join a Medicare prescription drug plan, have Part A and Part B to join a Medicare Advantage plan with drug coverage, have Part A and Part B or only Part B to join a Medicare cost plan with drug coverage. You must live in a planned service area, not be incarcerated, not be unlawfully present in the United States, and not live outside of the U.S. You must join the plan to get coverage in most cases. Some people who have extra help for limited income and resources, they're automatically assigned plans. So when can you enroll in a Part D plan? Well, during your 7th-month initial enrollment period, when you're first being entered into the Medicare system, during the yearly open enrollment period, which is coming shortly, October 15th to December 7th, coverage is starting in January, and other times, Medicare Advantage open enrollment period, which is January through March 31st of each year. And then there's this special enrollment period for those people who did not enroll in Medicare when it first offered to them because they had insurance to their job and they didn't feel like it was necessary to enroll in Medicare at that time. And then any time for people who get extra help. So choosing a plan, you can choose a plan by computer or by phone. Use the Medicare.gov website. Call 1-800-MEDICARE. We normally make appointments with people. We have open enrollment clinics where we take calls in to help people. We usually sit with people in person to help them with their insurance and their questions, compare the insurance to see if they can make any improvements. But because of COVID-19, we're helping many people virtually over the phone. Maybe that's the case in your state. I would urge anyone in another state or town to see how their local office for the aging is coping and assisting people, just to make sure that you're getting the help that you need concerning reviewing plans. But if you have a home computer and you want to do that yourself, Medicare.gov is recommended. And the site actually saves your prescription drug data and all your information, so you won't have to re-enter it the time that you actually want to enroll. We also recommend that people practice using the site so that when you want to make changes, you'll be readily familiar and it's easier for you to do that. And all right, and you can also enroll in the plan website as well. And although it's not common for people to do a paper enrollment application, that's still possible. So should you enroll in Part D? Do you have credible coverage? If so, like perhaps from a retiree plan, or perhaps a person has prior military coverage, they wouldn't need to sign up for Part D, and there's no penalty if they have credible coverage in delaying enrollment into a Medicare prescription drug plan. But things that you want to consider: will that coverage end when you retire? How much does your coverage your drugs cost, what do the premiums cost for Part D plans, and if you're without credible coverage, late enrollment may mean a penalty, especially if you go beyond 63 days in a row without coverage. That lapse will cause you to be open to a penalty. In most cases, you can get Medicare prescription drug through which options? Is it choice A through Part A and Part B, choice B through Part B and Part C, or is it choice C, Part C and D, or D, all of the above?
I'll go against my grain.
I think I heard someone say C. Yes, you are right. Part C is another word for Medicare Advantage plan, which sometimes include drugs, usually include drugs, and we know Part D is drugs as well for original Medicare. Okay, now here's a tricky question. It's July. You enrolled in Medicare last year, but didn't enroll in the Medicare drug plan. Generally, when is your next chance to enroll in? Go ahead. Okay. Is it the A, the open enrollment period, initial enrollment period, C, your next birthday, 12 months after your initial enrollment period? So we're trying to figure out when is this person's next time to enroll in Part D. I think somebody said open enrollment period. Yes, you're correct. Okay, so Medicare Advantage plans, just another option, the way to get your Medicare coverage. Plans are paid from Medicare for a certain amount for each member's care. It's still part of the Medicare program run by private companies. You may have to use network doctors and plans to get your services. PPOs certainly allow people more freedom to see more doctors. HMOs want you to stick to the network, and types of plans may vary because of your geographical location and perhaps some of the extra benefits that you want included with the plan. If you join a Medicare plan, Medicare Advantage plan, you still got those rights and protections you had in original Medicare, but the Medicare Advantage plan offers those services instead. In most plans, Medicare Advantage plans include the prescription drug benefit and may have different benefits and cost sharing offered at Medicare, not at the plan's expense, not Medicare. And some of those extra benefits are vision and dental, which are not covered by original Medicare. And some of them may also offer the over-the-counter discount card or exercise benefits as well. And when is your chance to enroll in these Advantage plan? Well, the same time during any other periods. During your initial enrollment period, when you're first being introduced to Medicare, open enrollment period, October 15th through December 7th, and for coverage that's going to start in January. And you may be able to join at other times, special enrollment period for those people who had employer health plans. You're going to contact the plan and call their phone number and visit their website and use the Medicare Plan Finder. Okay. So should you join a Medicare Advantage plan? You must have Part A and B to join, and most offer comprehensive coverage, including the prescription drug component. Some plans require to use a network. You may need a referral to see a specialist. You must pay the Part B and the plan premium as well. So you're going to continue paying your Part B premium regardless of whether you're on the original Medicare side or under the Advantage plan side. You can only leave this plan or join during certain times, and it doesn't work with Medigap policies, and it's not available to most people with end-of-stage renal disease. So we're just going to compare some differences between original Medicare and Medicare Advantage. Sometimes it can be confusing, and this chart helps to clarify some main points. So original Medicare covers Part A hospital and Part B benefits. Medicare provides this coverage directly. Medicare Advantage plan covers Part A and Part B benefits and may cover additional items like the vision and dental and sometimes hearing. Original Medicare, you have a choice of doctors and hospitals that are enrolled in Medicare and accepted new patients, and that's nationwide. Medicare Advantage plan, coverage provided through insurance companies approved by Medicare. In most plans, you need to use plan doctors, hospital, or other providers, or you pay more or all of the cost. Original Medicare, generally you or your supplemental coverage pay the deductibles and co-insurance. Medicare Advantage plans, you pay the monthly premium in addition to your Part B premium and a co-payment for co-insurance for covered services. Original Medicare, you usually pay a monthly premium for Part B. So you pay for Part B in either situation, but how you're going to be billed is vastly different. So next we have Medicare supplement insurance policies and Medicare Advantage Plan, otherwise known as Part C. Supplements are sold by private insurance companies, and so are Medicare Advantage plans. Government oversight. Well, supplements is overseen by the state, but also follow federal laws. Medicare Advantage plans overseen by the federal government, approved by Medicare. Supplements only work with original Medicare, and Advantage plans does not. Supplement fills the gaps in original Medicare, like deductibles, coinsurance, and copayments for Medicare covered services. Medicare Advantage plan covers all Medicare Part A hospital covered services, and Part B covered services and supplies may cover things not covered by original Medicare, like the vision and dental. Medicare Advantage plans include prescription drug coverage, most of them do. And you must have Part A and B to join either one, the supplement or the Advantage plan. And do you pay a premium? Yes, you pay a premium for the supplement, and you continue to pay the premium for Part B. For Medicare Advantage plans, yes, you continue to pay your Part B premium. In most cases, you pay a premium for the Advantage plan as well. In some cases, they're $0, these Advantage plans. That's because the money that you were paying for original Medicare gets moved over to the plans, the companies who are offering their Medicare Advantage plan. And that's how sometimes you can find one for zero cost. But usually when that happens, the copays at the hospital and the doctor's office tend to be higher. So Medicare Advantage plans, is it A, help pays for gaps in original Medicare? B, covers less than original Medicare? C, are private plans approved by each state? Or D, must cover all Medicare Part A and Part B services? Do we have any guesses?
Go with Christina and say D.
All right, excellent. Generally,
when in doubt, guess D.
all right. Well, it's worked certainly before. All right. So generally, if you have end-of-stage renal disease, you can't enroll in the Medicare Advantage plan. I don't know if you guys caught this one earlier.
True.
Yeah, it's true. Now, imagine this for a second. Advantage plans, you can't have a supplement, so you won't have a supplement to eat up any leftover costs. So, you know, if someone had a really debilitating illness or disease, you can imagine the cost that they would have. Advantage plans usually works well for people who are, you know, who don't have too many health issues or pretty much healthy.
Isn't there a cap? Is there a lifetime cap on Advantage plans?
A lifetime cap? Oh, I think I know what you mean. Do you mean a out-of-pocket spending limit?
I mean, like, it'll pay up to $1 million of expenses and then you're on your own? Not a stop loss, which is what you were referring to? I think they do, and I think that in the past when I've looked at them, that's a disadvantage. The big pro is they're cheaper.
Right. Cheaper initially, depending on your health circumstance, because, like you said, they could end up costing you more. So that's why it's so important for people to monitor their situation and to change their health coverage according to what their health circumstance is at that time. To my knowledge, the closest thing that matches to what you're saying was the out-of-pocket spending limit, but it doesn't sound like that's what you mean.
No, that's called a stop loss. You prevent it from losing more than X.
Correct.
I'm looking at threshold of what they will pay, and it's my understanding that the Medicare Advantage plan, I always thought was inferior because it didn't pay as high a limit if you have something, which is probably why it won't cover renal, because the cost is so high, you'd possibly run out. I'm not certain of that. It was more of a question.
Right. Well, that's an interesting theory. I don't recall a threshold amount, but you could be correct. I just know most people with serious illnesses, they don't seem to work well for those individuals.
I think it has to do with the threshold.
Yeah, you may correct. I just don't want to speak on a threshold because I don't.
I want to flag that as a possible. Just
okay.
I'm going to add a quick
It is possible that's correct. It is possible. All right.
I did just do a quick Google. It doesn't say that there's a limit, but I will keep on searching and we might know more by the end.
That word is going to stick in my head. Okay. So now this situation that's on the screen now, Medicare and the health insurance marketplace, this may not apply to anyone. Does anyone have the marketplace health insurance or through their state? Anyone? No?
Anybody else there?
Okay.
Yes, we do.
I thought so.
Okay.
Good.
All right. Well, so at least this applies. All right. So, all right. So Medicare, and this is just for you then. So, because sometimes there were confusion between the marketplace and Medicare coverage about when to sign up, and so this sort of clears that up. So Medicare isn't part of the marketplace. If you have Medicare, you're covered and don't need to do anything to the marketplace. The marketplace doesn't offer Medigap or Part D plans, and it's against the law for someone who knows you have Medicare to sell you a marketplace plan, even if you only have Part A or B. You can keep your marketplace plan after your coverage begins, but once your Medicare Part A coverage starts, you'll no longer be getting any premium tax credit or cost savings you were getting for your marketplace plan. You'd have to pay your full price for your marketplace plan, so sign up for Medicare during your initial enrollment period, or if later, you may have a late enrollment penalty for as long as you have Medicare. Okay. Medicare, people with disabilities, and the marketplace. So you may qualify for Medicare based on a disability. You must be entitled to Social Security benefits for 24 months. On the 25th month, you're automatically enrolled in Part A and B. If you're getting Social Security disability insurance, you can get a marketplace plan to cover you during your 24th month waiting period while you're waiting to become eligible for Medicare. You may qualify for premium tax credits or reduced cost sharing until your Medicare coverage starts. You can choose the marketplace coverage instead under the following conditions. If you're paying a premium for Part A, you can drop your Part A and Part B coverage and get a marketplace plan instead. Or if you only have Part B and have to pay a premium for Part A, you can drop your Part B and get a marketplace plan instead. Or if you're eligible for Medicare but haven't enrolled in it because you'd have to pay a premium for Part A, or you have a medical condition that qualifies you for Medicare, like end-of-stage renal disease, but haven't applied for Medicare coverage. Or you're not collecting Social Security retirement or disability benefits before you're eligible for Medicare, or you're in your 24th month disability waiting period. Now, it's against the law for someone to sell you a marketplace plan if they know you have Medicare. True. I heard somebody say true. Okay. So this is help for people with limited income and resources for the Medicare Savings Program. We've talked about the Part B premium of $144.60, and there's also premiums for supplements and premiums for Part D, but the Medicare Savings Program offers help for paying the premiums for Part B and Part A. And any money saved there could be used to pay for a supplement as well. So the Medicare Savings Program helps from your state paying Medicare costs, including the premiums, deductibles, and coinsurance. And as a result of that, they also get this benefit called Extra Help, which is help designed to help pay for Part D prescription costs. And then we have Medicaid, which is a federal state health insurance program for people with limited income and resources. And then there is Child Health Insurance Program, covers uninsured children up to age 19, and may cover pregnant women, and helps families qualify for Medicaid, helps families qualify who otherwise had too high of an income to qualify for Medicaid. Okay. So how are Medicare and Medicaid different? Okay. Medicare is a consistent program across the country. Medicaid statewide program that varies from state to state. Medicare administered by the federal government, Medicaid administered by state governments with federal and state partnerships. Medicare, health insurance for people who are 65 and older, and people under 65 with certain disabilities, like end-of-stage renal disease. Medicaid, health insurance for people based on need, financial, and non-financial requirements. Medicare, nation's primary payer of inpatient hospital services to the disabled, elderly, and people with end-of-stage renal disease. Medicaid, nation's primary public payer of acute health care, mental health, and long-term care services. So there's some distinctions there. And here we have a chart for the Medicare savings program. Ignore the 2019 guidelines. I had just changed the income limit numbers to 2020. I forgot to change the numbers above for 2020, but these are 2020 figures. So at the top, a qualified Medicare beneficiary, short for QMB, an individual earning $1,061 per month, or a couple earning $1,430. They can get help with paying the Part A or Part B premium, and the same goes for the other categories. As their income increases, they're only getting help with one or the other, either Part A or B, and not both, as in the QMB level category. Any questions about that? Okay. Here are all the helpful websites. You can see at the top there, Medicare.gov, the website that we use to help people compare and enroll into plans, is Medicaid.gov, SocialSecurity.gov to compare and estimate your retirement benefits, and also to apply for Medicare. And then you would follow up with Medicare.gov to get the other components of Medicare, including the prescription plans or the Advantage plans. We got the health insurance marketplace for those people who are not yet Medicare eligible or don't who have insurance through their job, and health insurance program through InsureKidsNow.gov, and CMS, educational resources and trainings, and health insurance assistance program. That is us, SHIP. We're SHIP counselors, and now I'm done with the presentation, and thank you so much. But I'm left here to answer any other questions, or I'm going to give you my contact number. If you perhaps have a question that you didn't get a chance to answer, I can call you back. Or we can, I'll have some questions.
While you have that up on your screen, all those websites, if everyone looks and pays attention here, it's all .gov. If you do Google searches, things like that, there are websites that will pop up with very similar website addresses, but they are not .gov. So you might see like Medicare.com or things like that. Make sure you're going to the .gov website, just to make sure you actually are going to those government sites to help yourself.
That's a good point, Adam.
It is.
Heidi,
I have a quickie question.
Yes.
Somebody else have one?
I had a question. It concerns, well, you know, you hear the possibility that the Affordable Care Act might be overturned by the Supreme Court this year. If that happens, can that affect the Medicare programs that concern primarily about pre-existing conditions and such?
It's hard to speak about something that has not occurred yet, but I imagine it could impact Medicare, because through the Affordable Care Act, there was more provisions included under Medicare. So there was some improvements under Medicare based on that legislation. I should hope that it doesn't I hope that you don't lose any benefits under Medicare. We don't want to see that. No one wants to see that. But I'm glad you brought that up. It's so important, though, why you brought that topic up, is for every senior to reach out to their local senator, their congressman, and to let them know how important the program is for you. We all know how important it is, but your voices must be heard, and it's a concern for you, and I thank you so much for bringing it up. But I think my people here have deaf ears, but that's okay. Yeah.
Keep on talking.
Yeah.
Carol, I should let you know, though, that pre-existing conditions typically come in if there's a lapse in coverage. So you should be, even if there were changes in the future, I would hope that as long as you don't have a lapse in coverage, that would not affect you, even if there was a change in the actual Medicare benefits.
Yeah, you're even better off overlapping a day to avoid that.
Yes, that's very true. I didn't hear that part of the question because there was some kind of difficulty hearing that, but you're correct. It's better to be safer by having your coverage overlap than to have a space in between. Absolutely.
That's what I would suggest. I had a quickie question on people who are on a Medicare supplement and they opt not to enroll in Plan D, which is the prescription coverage, because they don't take any prescriptions. they're going to get nailed with a lifetime penalty if they buy it later. Is that a ticking clock of the longer you wait, the more it costs, or are you kind of zapped from day one because you didn't buy a Plan D because you didn't need it, and now you do?
Thank you. That was an excellent question. So it's an amount. So at the time that a person goes beyond 63 days without prescription coverage, and if they don't have other, the key is other credible prescription coverage. All right. So it's not just being without Part D; it's also having access to other means of credible coverage.
Yeah. Let's say they don't, which is usually the case.
All right. So then they open themselves up to a penalty after not having any form of credible coverage after 63 days. So they start calculating how long, and that penalty grows. You're correct in assuming that penalty grows as time goes. So the penalty is added for all the months that they went without Part D, and so you can imagine the longer that someone goes without Part D, and without good reason, that penalty is accumulating. And then it ends up being a percentage of the average cost of a Part D for that current year. So it's a percentage that's tacked on to the actual going rate of the Part D. The only way to get rid of that at that point is perhaps maybe the person was misinformed somehow, or that's one, or another is the Medicare Savings Program that could eliminate the penalty. But that's for people with limited income and resources, as we've seen on the page.
Yeah, so if they have limited resources, they might not have to pay that, or they might automatically be enrolled in D?
Well, I said limited income and resources. Yeah. So if they apply and approved, then eventually the penalty would be eliminated. And that's for Part B and for Part D.
Right. Thank you for that.
Yeah, and for Part A. So the Medicare Savings Program can eliminate all those penalties. But the trick is, really, if someone's income is low enough and their resources is low enough to qualify for the program. So, yeah.
Any other questions out there?
Yeah, I have another one. I know that some people, wonder if they should sign up for the GAP. They have Medicare Part B, but should they have the GAP insurance? Because, well, they say that I don't go to the doctor enough to really qualify for getting one of those policies. But if I understood the presentation, these individuals, if they wait longer than a certain period of time, can be denied, or they have a little caveats that come into play if they want to get the GAP insurance later on. Did I understand that correctly?
Yes. First, I want to say Medigap insurance or supplements is the same thing. And if a person doesn't want to get a Medigap policy, that's fine, but they have to realize that they're responsible for any leftover costs from original Medicare at that point. And also, when you first turn 65 and you're enrolled in Part B, they say the best time to purchase a Medigap policy was in the first 6 months, because you have guaranteed protections to get that plan without a pre-existing waiting period. So that's why they say the best time to purchase it was within the first 6 months you have in Part B, and, is because you don't have to worry about the pre-existing waiting period during that time. You can still get a supplement or Medigap policy after that. It's just that the pre-existing waiting period may come into play, but it can be lessened if you had credible coverage before the carrying out of the policy.
It's only 13 months, right?
I couldn't clearly hear that.
I think it's only a 13-month pre-existing waiting period if you enroll late.
Well, if we're talking about supplements, so the last time I looked at the supplements in Clinton County, I've seen a pre-existing waiting period, just supplements alone. I've seen pre-existing waiting periods for 3 months. I've seen for 6 months.
Really?
I've not seen any longer than that. So I'm not sure which plans you're referring to in your area, but for Clinton County, I've seen them 3 months, 6 months, maybe 7 months, but not much longer than that.
Well, if people messed up, no big deal. You've got to get coverage. You have to roll with it, and you have to take on that risk, right?
Well, yeah. I mean, if they didn't have a supplement, then they'll have to think about how they're going to pay those leftover costs of Medicare. Now, the funny thing is that no one's going to say you need a supplement. It's optional, and you won't get a penalty for not getting one. It's up to your choice, but you really have to look at your health circumstance, see how likely you are to encounter such health expenses throughout the year. I mean, you know your health history better than anyone else. So consider, if your year went pretty well this year, you might be okay. But as we age and as we get older, the circumstance is more likely to happen that we're going to need more doctors and hospital visits. And we don't want that to adversely affect our income or anything else.
Absolutely.
Yeah. John, I see you out there. You have any questions?
No.
Nope, good. All right. Any other questions out there?
Actually, I do have one quick question.
Oh, there you go.
For somebody retiring in December,
Okay.
they need to apply for Social Security right now, or they can apply early if they want for Social Security, but they should also apply for A and B right now. Is that correct?
Yes, and I'm going to tell you why. So the person that you're talking about is eligible in December, right? Now, mind you, we got this pandemic thing going on, and it's always good to be proactive and give the administration enough time to process your Medicare cards. You also want to give them enough time to process your application for your Social Security monetary benefits so you can get your money on time and you could provide the necessary documentation so that can happen. Because of COVID-19 has affected staffing and other things in extended timelines, you always want to be right on top of things when applying. And I would suggest you go to the socialsecurity.gov website, which is ssa.gov. All right, make sure it says the .gov piece, and then you could apply for your monetary benefits, which is the money you've contributed to Social Security, and then you could apply for A and B at the same time. And so that way, when December comes, you're getting your Social Security monetary benefits, but Part A is usually free. Remember, Part B is $144.60. They can deduct that amount from your Social Security, so then that's convenient for you, and then everything is fine. But you definitely want to apply for that at the same time. It just sort of speeds up the process. Now, if you were working and you weren't going to retire, you reached 65 and you said, well, maybe I'll continue working past December. Well, then in that case, it might be beneficial for somebody to delay Social Security monetary benefit, and while they're working, they can still contribute to Social Security, allowing that to be bigger as they work 1 or more 2 years. And they might just take the Medicare out if there is no insurance to that job. So I hope that answers your question. I want to look for it further, but.
If the birthday is on December 23rd, and you apply for A now, then it's effective December 1st, correct?
Absolutely. You are correct, sir.
And as far as any kind of supplemental, whether it's Advantage or one of the Medigap G or N or whatever.
I just want to say one thing. It's important to never let's refer to supplement as supplements, and let's refer to Advantage plans as Advantage plan. It's so crucial to speak about it in the right terms, because I want you to know Medicare from this point for the rest of your life. And if we use the wrong terminology, it leads to confusion in the future. So whether you're talking about supplements or Advantage plans, correct. I'm listening.
Supplement or Advantage plans you have from October 15th till December 7th to decide on that.
Well, that's partially correct. Supplements, there's no special time of the year. In New York State, there isn't. So I'm not sure what state you live in, but in New York State, there's no certain time of year to enroll in a supplement. They may be true in other states as well, but the normal open enrollment period is where you can change into Advantage plans or Part D, and you could access all Medicare plans during that time.
Now, the supplemental plans are the ones F, G, N, all of those.
Correct. Correct.
There's also a separate, some companies offer a separate, if you choose that route, vision or dental, don't they?
Right. Now, you're so right. Some of the very same companies offering supplemental plans, you may find some names that you're familiar with. They may also offer a rider. And a rider policy is just another policy that can accompany the supplemental policy and may offer dental or vision or some other form of coverage that you're interested in. On the opposite side of the spectrum, Advantage plans, some of those can offer dental and vision, which is already incorporated in the plan. So, yeah. And you might save money if you're talking about supplements and you also get another plan by the same supplemental company. Maybe maybe there's an incentive to keep the business with them. I don't know, but it's something that I would inquire about.
Okay. Thank you.
Yeah, you're welcome.
All right, any other questions? You're thinking about it, aren't you? Go ahead, unmute yourself. You can ask the question. No?
Yeah. Now remember, if you didn't think about your question now, you can always email me a question at, I can give you my email address. So it's Ronald.Gist, which is Gist, at ClintonCountyGov.com.
Great. All right. Well, thank you very much, Ron, for doing this presentation for us and answering all of our questions. You know, I think this is always a tricky topic for people. So we really, it was great of you to help us out and get us a little bit more knowledge there.
Well, I thank you. I thank all of the participants for your questions. I appreciate that. You brought up some questions that weren't immediately at my mind, but I've dealt with before, so I appreciate that. It also kind of makes it more fun and talk. I mean, you try to make Medicare as fun as you can,
Yeah,
for sure. A lot of information. That's
yeah. It is. Yeah. It's really quite complicated. It's been enlightening, and thank you so much for your vast knowledge and expertise. It's been most helpful.
You're welcome. And remember, I can email you any training aids for Medicare. We have charts and diagrams. Some people like to put a chart up, so when they're referring to a certain component of Medicare, they have a chart to refer to, so then they know which part of Medicare they're talking about at that time. And knowing that is very good, because when you're trying to handle claims or if there's a dispute in charges, you really want to identify which plan you have first. If there's a chargeback or you're dealing with some issue there, sadly, sometimes when people don't know exactly what plan they have, it can make it more difficult to handle or resolve a matter.
Sure.
Right. All right. Well, thanks again, Ron. Thanks everybody for joining us today. And we'll let you get back to your evening, maybe get some dinner, something along those lines.